Well, I'm thrilled that we were able to put this workshop together because I can see by the representation in the room that it's going to have a profound impact on both the design of the facility and our ability to really reflect patient, staff, and medical staff perspectives.
We've been brought in by West Park to help navigate through the early pre-design process to help establish all the wants and the needs that the hospital will want in their new facility.
The Design Innovation Workshop is really intended to follow up on those flow assessments to take it to the next level. And what better way to innovate than to ask the team that actually does the work to envision how they could do the work in the future in a much better way.
We looked at the current flows that occur at West Park, and we looked at optimizing those flows and making them more efficient and effective for the patient, bringing services to the patient where it makes sense.
What it really speaks to is the West Park Healthcare Center's acknowledgement of the importance of research and innovation, as well as the integration of research and clinical practice.
So we have our clinical staff, which includes nursing, allied health, other clinicians. We've got physicians in the room. We've got patients and family members. We've got people from housekeeping. We've got people from throughout the hospital. And I think it's great to be able to bring them together, to be able to be looking at floor plans, to look at spaces, and for them to provide their lived experience so that as we're deciding what exactly this is going to look like or what do we need, we've heard from everybody.
I think it's very important to get patients' input in situations like this. We are the customer, so it's important to ask us what works best from our point of view.
We've come together to begin to build a facility that will serve the patients and their families well.
I think it's important to gain the perspective of various professions, individuals who participate in patient care, so that we can come up with a facility that is going to meet all of our needs.
Since I'm an OT, I'm definitely focused on what the OTs need from the complex continuing care side of things, but also keeping in mind all the other disciplines and really making sure that we're not missing any important pieces and that it makes it logical and efficient for everybody.
Working as a veterinary nurse on the CAVC, our priority is safety. So it was very important as a nurse to not only think of us as a nurse as well, but the other disciplines and how can we best be in close proximity to each other or, relate to each other in our design.
When we really were looking at prioritizing what are the key features and the most important things that we need to consider in building this, that's when the patient's feedback really was helpful.
In space design, walking that extra distance really translates into a longer wait time for care. And our top priority as treaters and as frontline workers here at West Park is patient satisfaction, maximizing the best patient experiences by maximizing their physical, social, and mental well-being. These metrics are being taken into consideration here at this 3P event at West Park.
I was most impressed with the idea that everybody's concern is patient care. It's reassuring to me as an outpatient to know that that's the priority.
Our programs and the needs of our patients are driving the design of the hospital, but then the hospital is opening up new opportunities for us to develop better programs and services.
It's amazing to be able to come together for 3.5 days to really think out loud and together.
So this is just the beginning, and I think we want to keep the engagement, we want to keep up the momentum. We had a good group of people in that room today. We want to spread the word. We want to make sure that we bring that back to others at West Park and that they continue to help us plan and guide our future.